My research area over the last 7 years has focused on diabetes and exercise, and I've published 5 different research papers on this topic alone. I've learned a ton about diabetes through my research and through this YouTube process of sharing my research and other researchers' work with you. In this video, I'm going to cover the top 10 things that I've learned about diabetes over the last 7 years. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. For all the points that I'm going to make today, I've already made videos about them, but I'll make sure that I put links to all the videos down in the description. The first thing that I learned is that it only takes one strength training exercise session to lower blood sugar levels, improve other diabetes risk factors, and boost mental health. In people with diabetes, one of the most important aspects of health that they need to be aware of is how exercise impacts blood sugar levels. In a review that my research team conducted, we found that one strength training session can reduce blood glucose levels by up to 14.5% for up to 24 hours. It can reduce insulin levels by 48% for up to 18 hours. It's more effective than moderate intensity aerobic training or cardio in terms of lowering blood pressure. And if it's done 45 minutes after a meal, it can lower triglyceride levels in the blood by up to 92%. Now, exercise has to be done on a regular basis in order to increase these benefits and maintain these benefits, but it's pretty powerful that the effects are fairly immediate. The second thing that I learned is that diabetes and mental health are very closely related. And people with some mental health conditions like depression or schizophrenia, without any other contributing factors, these conditions can lead to the development of diabetes. And once a person has type 2 diabetes, this increases their chances of developing depression by 100%. Insulin resistance seems to be the common denominator here. With insulin resistance, like in diabetes, anxiety and depression may emerge because insulin resistance is thought to have a negative impact on dopamine production. And dopamine is a chemical in our body or a neurotransmitter that's linked to us feeling good. People with bipolar disorder are 1.6 times more likely to develop diabetes. And whenever blood sugar drops in diabetes, this situation is sometimes linked to panic attacks and experiencing delirium. Last point here on this topic, impaired glucose tolerance, which often leads to diabetes, is a common side effect in some medications that are used to treat mental health conditions.